So hello, everyone. We have Alina and Armen, who are both the parents of Noah. So good to see you both. Good to see you home.
Good to see you. Thank you.
So, well, first of all, thank you so much for agreeing to just share some of your story. And I think for hopefully future parents, that will also be very valuable because I'm hopeful that this will give them some insight about what to expect. And I know you've been recently in the hospital, and I think you've been only 1 week back at home with Noah. So
Yeah.
you'll be able to give us a fresh outlook of your experience as parents going through all of this, which, I'm sure there were ups and downs. So, we want to hear everything that you are willing to share today. On va essayer de faire un petit peu français-anglais parce que je sais qu'on a aussi des familles, on a beaucoup de familles, à vrai dire, à l'hôpital de Montréal pour enfants qui sont bilingues et donc qui viennent soit d'un environnement plus francophone, anglophone ou allophone. But I don't want to be the one, speaking the entire time. So first of all, thank you for agreeing to share your story. And I'm going to open up for you guys to actually tell us, your story.
Yeah. And thank you for making these videos. I think it's such a good idea. And I know that when we first found out about Noah's diagnosis and I was trying to get my hands on any information I could find, first of all, there wasn't a lot of information. And a lot of the information that you find when you're first Googling can be really scary when you first receive the diagnosis, especially because when we received it, we were at another hospital. We weren't at the Glen site. So they maybe had a little bit less experience. And the way they announced it to us was, I mean, it is a serious condition, and they told us in a very, serious way, and they didn't provide much extra information aside from just explaining that the abdominal organs were going up into the chest, the stomach was in the chest. That's what they saw. That was able for them to pinpoint that it was CDH. And so with very little information, we were sent out of that ultrasound office that we had been looking so forward to because we were so excited to find out the gender. And so we were really crushed. And so, yeah, just to say that I know something like this would have been very reassuring for us to see too.
Yeah, I know.
Yeah.
It's very hard, sometimes it's hard to be in the shoes of the families and the parents. And that's what I'm hopeful to bring to future families. I personally meet families before birth, and that's how we first met, actually, initially, if you remember well. Yeah. And then sometimes we can give our spiel of doctors or healthcare professionals, but hearing some other parents about their own experience and reality really makes a big difference, I think. For some future parents who are in similar situation. And obviously the story of everyone is, unique to themselves and unique to their own family, and everyone comes with their own, dreams and challenges and strengths. But I think at the end of the day is to show that, there's a lot of humanity also that goes through even the medical system. And hopefully we can bring that back and try to kind of bring back the joy of the pregnancy and joy, the joy of the family, when even there are situations that are more challenging, because that's the goal. It's like, right, you're pregnant, you're a family, you have wishes and dreams, and as doctors, we can bring information and try to clarify as much as possible to the limit of our knowledge, but we cannot be families that share their own experience, right? So I would love to hear more. So you spoke about the fact that you arrive at your first appointment and you had a diagnosis of congenital diaphragmatic hernia in Noah. And so I guess, what was your first reactions? What were you thinking? What were your mindset at that point?
Well, like I said, when the doctor first told us, she was very serious, and then, and she was like, okay, we need to make appointments at the Royal Victoria Hospital right away. And it was just like so much information all at once, especially because, as I think is often the case with CDH, things are normally, or at least for us, like everything was pretty fine, like actually completely normal up to that point. And And so we had let ourselves, feel like, okay, we're crossed, we've passed the beginning where, things are not sure. There's a lot of risk, usually more in the beginning of a pregnancy. So to get that information after every single test and, the prior ultrasound at 13 weeks, everything had come normal. So it was very unexpected. And so we just, I remember after the appointment, we just like quietly walked to a park and sat down, and we didn't even really talk to each other. We were just on our phones trying to figure out what this is. And just that feeling of being really crushed.
I guess that moment until the first appointment we had with Vincent, with
Ponette.
Dr. Vincent Ponette, was that moment like of incertitude.
Tu peux parler en français?
Ouais,
oui, bien sûr. Vous aviez ces incertitudes. Ouais.
Et donc, c'était vraiment sur cette période où on vient de découvrir, on nous a posé ça dessus sur nous. Et du coup, on essaye d'avoir des informations et surtout, qu'est-ce qui a engendré ça, ce genre de choses qui en fait n'arrange rien en fin de compte, parce que la meilleure chose à faire à ce moment-là, c'est de rester calme et de ne pas stresser, parce qu'en fin de compte, on ne peut pas faire grand-chose.
Exactement.
Et donc, ouais, jusqu'à ce rendez-vous avec le docteur Ponette, c'était difficile. Et, mais après...
I think as soon as we got to get to meet everyone at the Royal Victoria Hospital and at the Children's Hospital, like Dr. Ponette, Dr. Laberge, you, I mean, so many other people, like you were saying, you do try to bring this human aspect. And I really felt that. And for myself, I hadn't had that much experience in the health system. I just knew, like, for me, as thankfully, like a healthy adult, I had only experienced frustrations, having to like wait a whole day to get an appointment at a walk-in clinic, having to wait 2 years to find a family doctor. So for me, it was just like, we're doomed, and no, actually, you guys were so attentive. You were so human. I mean, I was so surprised the first day that when we saw Dr. Vincent Ponette, he gave me his phone number and he said, feel free to call at any time if you have any questions, and other doctors too. And it was amazing.
I'm happy to hear that at least you encountered some humanity even during, like the pandemic and the stress level. And, that also adds another layer of stress, of course, right? Like you think you're going to go to the hospital, you don't know who you're going to meet. You don't know, if you're going to have access, you're going to need to organize everything yourself or not. So of course, that adds on for sure some stress. And I really hope, j'espère vraiment qu'on vous l'a dit, et je me rappelle pas si je vous l'ai dit, parce que je pense papa a adressé quelque chose d'intéressant. Il a dit, tu demandes ce que tu peux faire ou qu'est-ce que tu as fait. Et souvent, c'est ça ce que beaucoup de parents, ils se demandent, c'est qu'est-ce que, il y a un peu de culpabilité ou there's a guilt that makes no sense. When you think about it, it makes no sense, right? Mais il y a beaucoup de parents qui se retrouvent dans une situation et qui disent, est-ce que c'est quelque chose que j'ai fait ou j'ai pas fait? J'espère qu'on vous le dit que c'est rien que vous avez fait ou pas fait. C'est la nature qui impose des choses sur nous. Hein.
C'est un peu un instinct de tout de suite chercher la cause ou ce qui a rendu, ce qui a engendré ces choses-là sur n'importe quoi. En fin de compte, genre, pourquoi moi? Qu'est-ce que j'ai fait que ça arrive?
Ouais.
It's hard to accept that something is completely random. Yeah.
Even if it is. Yeah. So let's move forward in time. And now you're at the situation where the pregnancy is ongoing. And I think you've met at this point a few healthcare professionals. You've met the NICU team, you've met surgery, the obstetrician, you underwent multiple ultrasound and fetal ultrasound for the heart of the baby. So there's been many appointments. So I think parents need to be aware that, it comes with the burden of coming to the hospital and being seen many times. And obviously that's for sure a challenge. I'm sure I can't even imagine, but I want to hear more about what happened after that. Once we saw that maybe the way Noah was going was towards what we call a more severe profile. And we were more concerned about well, what does that mean really after birth? Is that going to be a big problem for his lungs, knowing that it's a disease that can affect a lot of the lungs? So where were you at there? Dans quelle situation vous étiez? Peut-être parler un petit peu de qu'est-ce que vous avez vécu à ce moment-là.
Well, I want to say it was really a roller coaster ride, because when we found out that things were more severe, it was after, in the beginning, it seemed more mild. It seemed like a more mild case. And so all of the worries we had from the first diagnosis to those other ultrasounds, like from reading everything we had read, all of those worries were we were rest assured that, okay, it's mild. Phew. So we went like, I think a week or two thinking, okay, things are mild. And then all of a sudden, I think it was after the MRI,
and the cardiogram, the echocardiogram with Dr. Gagnon.
Yeah.
Ultrason que Dr. Gagnon a fait en obstétrique, ouais.
C'est vraiment
No, that was not the echocardiogram. That was...
No, it wasn't the echo. It was
just another MRI.
Yeah,
it was just an ultrasound. Yes,
but he was the one who announced us that, like, he just had the result of the MRI, and also he saw through the ultrasound that he did, like, okay, like it's more severe, and you potentially are a candidate for the fetal procedure.
Yeah, that was a second shock, because we really didn't think we needed that. At first they said, oh, there is this thing called feto, but you won't need that. So we were reassured, and then to hear that actually things are more severe and we would need feto. And then it was everything really fast, because you're pregnant, every week the baby is growing and there are deadlines. And if you want to get feto, well, it has to be, you have a very small window of time. So things move very, very quickly. So I remember Dr. Gagnon said, well, you need to have an amniocentesis now. So that
was another thing we were hesitating to do, because before that it was like optional. There was some risk related to amniocentesis, and all of a sudden, okay, there's like forget the risk, we have to do it to see
if you want to have feto, then we need to do an amniocentesis. So that all happened the same day. It's really intense, like the emotions.
I'm sure. I can't even imagine, like you come, and obviously when things go so fast, it's so hard to put ourselves in your shoes. And I think no one can put ourselves, in your shoes. And to be told suddenly, okay, well, on top of it, that it's getting more severe, now we need to do a procedure to get a bit more information to see if you're going to be eventually a candidate for this potential treatment. And so just for people listening, feto is basically where they put a little balloon in the airway of the baby before they're born. And this balloon, has been shown to help some babies with more of a severe profile to get their lungs bigger, and then hopefully help them after birth. But, if there are some genetic diseases associated with, the condition, then sometimes, we discuss if it's beneficial or not to actually do the procedure. Is it going to work or not? I think that's where things had to kind of spiral very quickly, because obviously doing the amnio and then the genetic testing on the amnio, well, these results take time. And obviously being in your shoes, I can't even imagine how much stress suddenly you're getting with this inflow of information. What is feto? Is it a brand of, crackers? Like, what does that mean? So, maybe we can jump a bit in time. And I just want to hear about, going through feto, what's your perspective? Because for future families, I can imagine that also this brings a lot of challenges and potentially sacrifices. And maybe I can hear the perspective of dad, and it would be great to hear it in French, and then the perspective of mom. Donc, juste vous entendre parler un petit peu de qu'est-ce que vous avez vécu justement quand vous avez dû aller pour la thérapie phyto. Et pour que les gens soient au courant, souvent quand on fait le phyto, c'est en partenariat avec Toronto, où est-ce que vous devez mobiliser toute votre vie là-bas pendant une certaine période de temps avant de revenir à Montréal pour pouvoir éventuellement avoir la naissance à Montréal. Donc, j'aimerais un peu voir votre perspective sur ce que vous avez vécu.
Ouais. C'était déjà la décision. En fait, c'était le mois de juillet était intense quand même. Parce qu'il y a une autre chose, c'est qu'on venait de déménager en juillet. C'était un truc en plus qui s'ajoutait. Du coup, la maison pleine de cartons avec avec les rendez-vous. Et là, 3 semaines plus tard, c'est ça, c'était. Tu vas aller voir le bébé?
Noah's crying.
C'était un peu sur le dernier moment où jusqu'au dernier jour, c'était pas très sûr parce que on était là, c'était sévère, mais en fait, c'était entre modéré et sévère et c'était vraiment c'était pas super évident s'il avait besoin de Fetoba, même si à la fin, ça a été recommandé et qu'on a dit OK, allons-y, si ça peut aider, il faut le faire. Mais donc ouais, c'est sûr qu'aller d'un coup à Toronto pendant un mois, potentiellement beaucoup plus. Et là, c'est la partie un peu stressante. C'était quelque chose. Après, la vie là-bas, en fin de compte, les rendez-vous sont assez peu nombreux. Il y a la première intervention pour mettre le ballon. Ensuite, il y a un suivi toutes les semaines. Et puis, il y a le retrait. Donc, c'est plus une période où on va dire un peu incertain. On est à Toronto. OK, pour l'instant, tout va bien, en espérant que ça continue. Il ne faut pas trop se fatiguer parce que voilà, ça pourrait.
Tu as parlé des risques.
Ouais.
Ouais, parce que ce que les gens savent peut-être ou peut-être pas, c'est que, doing the fetal procedure comes with the risk of preterm labor. And if ever you would have went into preterm labor while still being in Toronto, that means that you have to stay in Toronto potentially for the entire course of hospitalization of Noah. And that might involve weeks, months, who knows, right? So for sure, this is a stressful risk. And I think, for parents, I can't even imagine being in that limbo position. Must not be easy, but I really hope that we were able to help in a bit to prepare, about these risks. And maybe, Alina, you can share your own perspective on your experience going through fetal, because obviously it's on you that this happens, right? It's on Noah, but it's also on you.
Well, I want to say there's also great communication, not just between all the staff at Royal Victoria and the Children's Hospital, but also with Toronto. I felt like there was very good communication. They told me, I think Dr. Panette probably told me, okay, so someone is going to call you from Toronto, Dr. Ryan or Van Meegem, and give you more information. And so we received that phone call, and I think it was Dr. Ryan. No, it was Dr. Van Meegem who gave us who made the first phone call, and he took a lot of time to explain exactly what FETO was, what the risks were, the benefits, the statistics, the odds of, and we were in a tricky position because it's been shown that FETO is really beneficial for severe cases of CDH. Moderate, it's questionable whether it's really that much of an advantage considering the risk of preterm rupture of membranes. And we were just borderline moderate severe. So we were, just in between. But Dr. Van Meegem answered all our questions and helped us realize, for us, we came to the conclusion that statistically, like looking just at the numbers, and again, no one has a crystal ball, like you said.
The statistics, like just say it's another thing to look at carefully, I guess, in from the point of view of the parents. Like I'm sure for the doctors it's a different thing, but from from our perspective, it's like we shouldn't be like, oh, there's like 30% chance of this and 80% if we do this, so like let's go with it. Like you're not just like playing lotto or like I don't know, like
At the end of the day, Noah is one, right? He's like
yeah,
100% statistic. It's 0 or 100, right?
it
Yeah.
is. Yeah, so it's like just something that can help to reassure you or not, like, but you have to be like go easy on it and just yeah.
So what made us make the decision finally to do Feto?
Well, it was like because they were saying like there was they would see a real benefit to do it, and uh, like we just followed at the end
Yeah.
what the doctors would recommend, or yeah,
Mhm.
like didn't take any decisions based on we're scared or I don't know, we're too stressed about it. Yeah, at the end we just followed what was recommended, and it turned out well.
And I think it went pretty well, right?
Yeah.
So
Yeah.
at least we were, very happy about how things went through. And to my understanding, so Alina, you guys came back to Montreal a few days after the balloon was removed.
The balloon, yeah, we came back to Montreal the following day after the balloon removal because you want to get back very quickly. So we rushed back home and we were like, oh, huge sigh of relief. We made it. And I mean, things honestly went very smoothly. It was a huge weight off our shoulders that the Feto procedure went well and that there was no preterm rupture of membranes in Toronto. So it was like a sigh of relief. And we're like, okay, if we're lucky, we still have a few more weeks before Noah is born, knowing that on average, women who've had Feto usually go into labor on average at 35 weeks. And so everything went well the first day after we came back. And then that night, we went to bed and 30 minutes later, I woke up and my water had broke. And I really I wasn't expecting it. And I was like, okay, I guess this is happening now. And it was a bit stressful because it was Labor Day weekend. So I was worried that like it was the middle of the night, Labor
Is
Day
the
weekend.
hospital going to be open?
Hospital going to be open? Are all the wonderful doctors we met going to be there? But actually it was Dr. Gagnon, luckily enough, who was there that day and who delivered Noah. Yeah, it went really fast, but I felt like we were very cared for along the way, that there were people around us that we could trust and where we were supported by them. So
tell us more maybe now about, I guess, what you went through in the NICU, because now you're at the point where you're back in Montreal, oof, but boom, surprise, kind of 36 hours later, you're back in the hospital and now you're delivering and things are going very, very, very fast, I'm sure. And so it's the first time you meet Noah, although you've met Noah throughout the pregnancy, but now it's the first time you both meet finally Noah. Like, what are your emotions, your reaction, and then tout ce qui est survenu après par rapport à la néonate, votre séjour, ce que vous avez vécu, les moments de joie, les moments peut-être plus difficiles.
Ouais, moi je me souviens quand il venait juste après l'accouchement, donc le bébé sort et il pousse un cri, et je me souviens de ce cri, et ensuite, évidemment, il ne peut pas rester là, genre 20 secondes après ou 15 secondes après, il l'emmène directement pour l'intuber, et ouais, le cri, on ne le entendra que jusqu'à qu'ils enlèvent l'intubation, que vous enleviez l'intubation. Et c'était genre 3 semaines, il me semble.
Right. So yeah, for like about 3 weeks while he was intubated, we didn't hear Noah at all.
Yeah.
And I remember, and after he was intubated, I remember the nurses had said that afterwards, he'll have a very hoarse voice. And I was just sitting by his side, and I was so used to hearing other babies cry in the NICU that Noah was was crying, but like so faintly. And I just assumed it was coming from another room. And then I looked at him and it was coming from him. And I was like, oh my gosh, it's your voice. I think I've never been, so happy to hear a baby cry.
Yeah, he's very cute. I've met him a few times in the NICU because I was doing the ultrasounds, but
Yeah.
so tell us, how was your experience going through the NICU as parents?
I
The
think
goods and the bads. We want to hear everything.
it's really helpful that, like you said, we met before the pregnancy, before the feto, like from the beginning, and you had a video that you sent to us, like touring the NICU. That was really helpful. You talked about the NICU to us, and so you're going into it knowing what to expect. And I find, being able to mentally prepare for something goes a long way. All the times that were especially stressful during this whole journey was when something was shocking, the CDH, it's actually worse than we thought. But everything else we were kind of expecting and going along with what we were told would happen. Everything that happened to Noah, and they even told us in the NICU, like, this is more or less along the lines of what we expect. So nothing was, not to say that it wasn't difficult or stressful, but it was what we expect, and that takes a huge load off. Yeah. And then what do you want to say? Anything, Armen?
During the NICU time?
Yeah.
Yeah. Let me see. Well, with like, obviously there were all the doctors, but also the nurses were doing like a wonderful job, like always telling us what's going on, what we gave him. He was crying, we had to give him some morphine, and then also we could just call at any time when we couldn't be there, for example. So that was like really just to know what's going on is like really helpful. And sometimes it happens like there's like something comes up and you need kind of to investigate. And I remember once something happened, I don't know if you heard of it, but he had a pneumothorax. It was very uncomfortable a moment, and I remember the nurse Millie, like at 10 p.m. I think she couldn't calm him down, and she requested an X-ray at that moment, and that's when they saw like there was some air accumulating.
Air accumulation, yeah.
And basically that was like they saw it at the right time, and they had to do a surgery, I think, to remove that air. So it was like like it was nice to see like oh, you guys like know what you're doing, and like being able to catch things before they get worse. Yeah. And even as parents, there were some other moments, like, anyway, like it's understandable for parents like to be like, oh, okay, what you're doing here, there's this, or like why is it like a bit more blue here? And there was a moment where I think we put some stress on one of the nurses, like they were trying to put the IV in his leg, and like I know on babies it's like very small, and it's it can be easy to like kind of miss it, right? And then
the peripheral intravenous line, yes. So we try to put little IVs and to poke.
Yeah,
they're like little hair, so the veins are very tiny, right? But
Yeah,
our
yeah.
nurses are the best. They're really, really good.
Well, I have no doubt, like even though on the moment it was stressful, I remember in Toronto it happened to Alina, where the nurse couldn't get her vein. So I'm like, well, if they can make the mistake on an adult, it can happen on a baby, and like there's no need to like to panic or anything like that. But even that, like they ended up doing it on his head, and it turned out well. But yeah, just to mention that, like at the end, we should just not like not get into the way and just let the nurse do their job and the doctors do their job, and because you're doing it wonderfully, and like, yeah, like just to trust the whole process you put in place, and it turns well.
I'm hopeful we were able to involve you both also in the care and in the decision for how Noah evolved throughout, like, because I would hope that, we're a unit that we really try to include parents in the everyday kind of evolution, and trying to hear your perspective as parents also on how you see your own child, because obviously parents are there all the time, so they know far better their child than, the doctor or the nurse, even if we try to get very involved, and we're obviously very involved, but parents are always the guardian of their baby. So for sure, we encourage them, at least I try to encourage them a lot, to be present during the rounds, for example, and, give us their perspective. And I wanted to know if you had well, we're going to talk about how Noah, is today and post discharge now that you're home. But before that, just for the aspect of all of this that you've lived recently, would you have at least one advice for future parents, comme un conseil de sagesse, something, you feel like is one important message that you would like to transmit?
Oh.
Fallait nous dire de réfléchir sur cette question avant.
It can be simple. It can be stay calm. It can be
I think really take it one step at a time. I remember I'm someone who I get anxious with uncertainty, and I want to know what's going to happen. And I remember when we first spoke, I was like, well, are we going to go home with a feeding tube? Are we going to go home with oxygen? And Noah's crying.
Yeah.
But and you were like, we don't know, everyone is different, every baby is unique, and but if you just take it one step at a time and focus on where we are right now and we could do right now, it really, really helps. I'm gonna go tend to Noah.
Okay.
In my turn.
For future dads,
I think what I can say is like kind of what I said before. It's the worst. There's nothing really you can do to suddenly improve the situation, but you can, and basically for the baby, you kind of not have a lot of choice than to just be patient and just yeah, just be patient. Ouais. Ouais, en gros, je disais qu'il n'y a pas, en tant que parent, on ne peut pas faire énormément de choses que de juste d'être patient et de faire confiance, comme j'ai dit, au processus, à tous les médecins, à toutes les infirmières. Mais on peut essayer d'alléger les choses qui nous arrivent et ne pas rajouter du stress, ne pas paniquer en plus. Évidemment, c'est plus facile à dire qu'à faire, mais vraiment d'essayer de j'ai envie de dire de se détacher, mais c'est compliqué, mais juste être plein d'espoir, on va dire, et se dire que ça va aller, et que voilà, il a la meilleure équipe possible autour de lui pour prendre soin de lui, et que nous on est là aussi, et que voilà, il faut plus qu'espérer et être patient.
Il est adorable, hein? Il est vraiment cute. Alors, comment vous faites? Vous lui parlez en français et en anglais à la maison maintenant?
Moi, je lui parle en anglais.
Ouais, moi, je lui parle en français.
Et quand on peut, on essaie de parler arménien aussi.
Wow.
C'est plutôt les grands-parents, ça.
Yeah.
He's very cute.
Trilingual baby.
So how are things going at home?
They're going really well. It's nice to not have to run to the hospital all the time to see Noah, to just be able to chill with him at home. And honestly, I remember in the beginning, I was really hoping that we wouldn't have to go home with oxygen or, or anything like a feeding tube. And thankfully he was able to progress really well with his feedings. But the oxygen, he was on the lowest oxygen that he could receive at the hospital, but it takes time and we don't want to rush them. And so it was better for us to bring Noah home with oxygen, just as long as it takes. It's really not as bad. Like we hardly notice it. I mean, sometimes it's annoying because we need to drag, the tube around with us everywhere we go. He's like hooked up to the machine, but the tube is very long. We could go almost anywhere, and it's great. And we have, people still checking in all the time. We had Alexandra, the nurse from complex care, come and visit, and we never felt throughout this whole thing that we were on our own. We always felt that there's someone there's a whole team of people there to support us no matter what we need, whether it's like a lactation consultant or a social worker or like really anything you could even think of, and even some things that you never even thought of, like those people are there and they're like, here's my number, call me if you need me. So it's reassuring.
I'm
It's
happy
fine.
to hear. And now, well, you probably know or don't know, but Noah will be followed for sure with the home oxygen with some of the professional at the hospital, but you're also going to be followed in the CDH clinic that Dr. Puli Glandla run. And so there's like a one-stop shop where you're going to be seeing like nutrition and gastroenterology and the respirologist and the surgeon and myself until he's like going to be 18. So we're gonna tag along you. You're stuck with us.
You're like our new family.
So
it's
really
reassuring.
Yeah, it's definitely reassuring, and
so really a nice story. So I'm so happy to see where you three are, where you both, you all three are right now. I got to meet him when he was very, very young, before even being born. So now it's very nice to see him, healthy, thriving, and growing. He's smiling.
He recognizes you.
Smiling. He's very cute. So I want to really thank you for like all the time you gave today to share your story. So that maybe future families may be able to listen and get, at least one perspective. And really, I think sometimes to hear and then see maybe gives you a better insight about a possibility of what to expect with, like you say, the roller coaster, the challenges, but, hope also at the end of the, at the beginning, I should say, of the story, right? Because right now you're just at the beginning and starting a beautiful adventure. So really, merci beaucoup pour tout votre temps, pour partager tout ce que vous avez partagé.
Thank you.
I will send you the link of the result of this little interview and video, and I'll post it, and then hopefully we'll be able to share it with future families that we meet, even from the prenatal life.
Yeah, I think that's going to be really helpful. It's a good project.
Yeah.
Yeah, thanks for
Thank
putting these together.
Thank you so much. I'll stop the recording now.
Okay.